Stand up right now. Go ahead. I'll wait for you. Now really pay attention to what just happened in your body. Did your muscles feel a little stiff or tight? Perhaps your legs gave a small twinge, or maybe you noticed a touch of mental fog creeping in. If any of that rang true for you, please know you're not imagining things, and it might not simply be a normal part of aging. According to data from the National Institutes of Health, close to 70% of adults over the age of 60 have suboptimal magnesium levels. Here's the truly shocking part. The vast majority of them have absolutely no clue this is happening. Why? Because standard blood tests frequently come back saying magnesium is normal, even though at a functional cellular level, it's too low to allow the body to operate at its best. I'm Dr. Michael Kent. For more than 20 years, I've dedicated my work to studying aging, nutrition, and the causes of chronic fatigue. Over that time, I've worked with thousands of patients who genuinely believe that feeling tired was just an inevitable part of getting older. But the truth I've come to see again and again is this: magnesium deficiency is silent, it's sneaky, it's widely under-recognized. Yet it is also surprisingly easy to correct once you understand what's going on. Everything you've been told so far about energy levels, quality of sleep, and those nagging muscle cramps as the years go by is incomplete at best. Doctors run the usual blood work, see numbers labeled normal, and often move on without digging deeper. But your body doesn't run on what shows up in the bloodstream alone. It depends on magnesium right down at the cellular level. That's precisely why symptoms like ongoing fatigue, nighttime cramps, restless or poor sleep, feelings of anxiety, and even occasional mild heart palpitations can creep up one after another, slowly chipping away at your daily quality of life without anyone connecting the dots. Over the next 25 minutes or so, I'm going to walk you through a clear, step-by-step protocol designed to help restore proper magnesium function in your body. This approach can improve your energy, help calm tense muscles, deepen and improve your sleep, and clear away that stubborn mental fog. And the best part is that it doesn't require extreme diet overhauls, complicated daily routines, or costly treatments. These strategies are grounded in solid, science-backed evidence drawn from respected research conducted at leading institutions such as Harvard, Johns Hopkins, and the NIH itself. Before we dive deeper, I'd love for you to take just a second and drop a quick comment below with your age. Nothing more, just the number. It helps me get a sense of who's here watching and which life stages are most affected by these subtle signs of magnesium deficiency right now. Because here's the important reality I want you to hold on to. You truly do not have to accept constant fatigue, painful nighttime cramps, or broken sleep as simply part of getting older. There's often something much more fixable going on. Let's take the time now to really uncover what's happening inside your body. Let me walk you through exactly what's taking place in your system. Details that almost no one explains clearly. Once you reach your 60s and 70s, your body experiences 4 major changes that have a direct and powerful impact on your magnesium balance. These shifts affect your energy, your muscles, the quality of your sleep, and even your overall mood. Think of your digestive system when you were younger. It worked like an efficient sponge, soaking up nutrients without much trouble. But as the years pass, that sponge becomes less effective at pulling in magnesium. Your intestines simply don't absorb it as well anymore, even when your plate is full of things like leafy greens, nuts, and seeds that are supposed to be good sources. On a clinical level, the small intestine relies on special proteins known as TRPM6 and TRPM7. These act as transporters that move magnesium from your food into your bloodstream so your cells can use it. Research published by the NIH has demonstrated that in adults over 65, these transporters function 20–30% less efficiently than they did earlier in life. What that means in practical terms is that even if you maintain what most people would call a normal or even healthy diet, your cells can still end up undernourished when it comes to this crucial mineral. I understand if you're feeling a bit skeptical right now. You may be thinking, I've eaten reasonably well for decades. Why would this suddenly become an issue? The answer is that the change is subtle at first. It doesn't hit you all at once. Instead, that small daily deficit builds quietly over weeks, months, and sometimes years. until one day you notice you're dragging through the afternoon, waking up with stiff calves, or lying awake with your mind racing at 3 a.m. If you've ever jolted awake with a painful leg cramp or struggled to quiet your thoughts at night, go ahead and type the word cramp in the comments right now so we know you're relating to this. Here's another place where so many people unintentionally go wrong. As we get older, our kidneys tend to become less efficient at holding on to magnesium. They let more of it slip away in urine. Compounding that problem, a number of very common medications prescribed later in life, things like diuretics for blood pressure, acid-blocking drugs for reflux, and certain hypertension medications, actively speed up the loss of magnesium from the body. Picture magnesium as money sitting in your personal bank account. When your kidneys start leaking coins faster than you can deposit new ones, that account balance slowly drops without you noticing, until the symptoms show up. The Harvard Aging Study followed more than 200 adults aged 65 and older across 5 years and discovered that individuals on long-term diuretic therapy had magnesium levels up to 25% lower than those not taking those medications. That's a significant difference over time. Beyond absorption and excretion issues, magnesium plays a central role in producing ATP, the primary energy-carrying molecule your cells rely on. Think of ATP as thousands of tiny rechargeable batteries inside every cell. Magnesium is required to fully charge those batteries. When levels drop, the charging process becomes inefficient, and fatigue moves in, not just the normal tiredness after a busy day, but that deep, heavy, all-day exhaustion that no amount of coffee or rest seems to touch. A study conducted at Johns Hopkins, involving adults between 60 and 75 years old, found that when they supplemented with magnesium, cellular energy markers rose by 38% in just 8 weeks, and that improvement directly translated to better stamina and noticeably less fatigue in daily life. Magnesium is also vital for proper GABA signaling. GABA is the main calming neurotransmitter in your brain. It's what tells your nervous system, it's okay to relax now. When magnesium is low, that calming signal weakens, and your nervous system remains stuck in a low-grade alert mode even when your body is physically tired. Imagine your car engine revving too high while idling. You want to downshift and rest, but the system just won't cooperate. That's exactly why low magnesium so often shows up as difficulty falling asleep or staying asleep, feelings of anxiety, or general irritability. And here's an important twist many people miss. Stress itself burns through magnesium at a much faster rate. So when sleep suffers because of low magnesium, stress increases, which depletes even more magnesium, which makes sleep worse. And the cycle keeps spinning. It becomes self-reinforcing. On top of all that, magnesium is the mineral that instructs your muscles to relax after they contract. Without enough of it, you get those sudden nighttime leg cramps, or perhaps you feel a subtle fluttering or skipping sensation in your chest. According to findings published in the European Journal of Clinical Nutrition, adults over 60 with lower magnesium status were 52% more likely to deal with muscle cramps and heart palpitations. At first glance, these symptoms, fatigue, leg cramps, broken sleep, irritability, occasional palpitations, can feel completely unrelated to one another. But in reality, magnesium deficiency often ties them all together like invisible threads. Next, I want to share a couple of real patient stories so you can see just how subtle, yet how profoundly life-changing, addressing this issue can be. Margaret was 72 when she first walked into my office. She looked me in the eye and said, "Dr. Kent, I eat well. I make sure to exercise regularly. I stay away from junk food, but I'm exhausted all the time. My legs cramp badly at night, and sleep has become a real struggle. Why is this happening to me?" On the surface, her blood work came back normal. But when we looked closer at functional status, her magnesium was clearly too low for optimal performance. We started her on what I call the Relax Protocol, a structured, gentle approach I've refined over many years. Within just 4 weeks, her nighttime leg cramps dropped by about 70%. Her sleep went from 4 or 5 hours of broken, restless rest to a solid 6 to 7 hours of much deeper, more refreshing sleep, and she told me she was waking up feeling mentally clearer and sharper than she had in a long time. Then there was Robert, 68 years old, dealing with persistent fatigue and the occasional unsettling heart palpitation. He described it this way: "Dr. Kent, I feel like my own body is working against me now. My energy has vanished, and every night I worry something's wrong with my heart. Again, standard labs looked fine. We applied the same relax protocol, and over the following 8 weeks, his blood pressure came down from 148/92 to a healthier 126/78. The palpitations became very rare, and his energy returned in a steady, noticeable way. At one follow-up, he smiled and said simply, "It feels like I got my life back." These stories are far from rare or exceptional. Multiple studies from Harvard, Johns Hopkins, and other respected centers confirm that when magnesium is supplemented thoughtfully, especially when paired with smart dietary choices, it can lead to real improvements in muscle function, sleep quality, mood stability, and overall vitality for adults over 60, often showing clear benefits within 4 to 8 weeks. That's exactly why it matters so much to use the correct forms of magnesium, time it properly, and dose it in a way that matches your individual needs. Choosing the wrong type or jumping in too aggressively can lead to frustration and minimal results. But when done right, the changes can feel almost magical. Now let's get practical. I'm going to teach you the exact protocol I use every day with my patients over 60. I've named it the Relax Protocol because the goal is to help your body truly relax and recover at a deep level. Relax is an acronym that stands for 5 key pillars: routine, eat, listen, absorb, and experience. These 5 steps work together to restore magnesium safely, effectively, and sustainably. Starting with step 5.5, routine, consistency over chaos. The foundation here is small, steady, daily intake rather than sporadic large doses. For most adults over 60, a target range of 200–400 milliliters per day works well, depending on your current diet, health status, and any medications. The smart way to begin is low and slow. Start with 100–200 milliliters daily and increase gradually only as your body tolerates it. Daily consistency allows your cells to rebuild magnesium stores steadily over time, instead of experiencing big swings. Step 4.5, eat. Focus on magnesium-rich foods. Build your foundation with natural sources. Excellent options include leafy greens such as spinach and Swiss chard, nuts and seeds like pumpkin seeds, almonds and cashews, avocados, beans, and lentils. When you pair these magnesium-rich foods with healthy fats, think olive oil, nuts, or avocado, absorption improves noticeably. Food should always form the base of your approach. Step 3.5, listen. Match the form to your specific needs. Not all magnesium supplements are the same. Choosing the right one makes a huge difference. Magnesium glycinate is gentle on the stomach, highly absorbable, and especially helpful for promoting calm, better sleep, reduced cramps, and lower anxiety. Magnesium citrate works well if you also deal with constipation, because it naturally draws water into the intestines to support regularity. Magnesium malate tends to be more energizing and can help with fatigue, muscle soreness, and overall vitality. One form you should generally avoid is magnesium oxide. It has very poor absorption rates and often causes stomach upset without delivering much benefit. The single biggest mistake I see older adults make is grabbing whatever magnesium is on the shelf without thinking about which form best matches their symptoms. Step 2.5, absorb. Pay attention to timing and synergy. Timing matters a great deal. Taking your magnesium in the evening often provides the best support for relaxation, deeper sleep, and fewer nighttime cramps. If you need higher amounts, consider splitting the dose, perhaps some in the afternoon and the rest before bed. Always take it with food to improve tolerance and reduce any chance of digestive discomfort. At the same time, try to minimize things that actively drain magnesium. Cut back on excess sugar, manage chronic stress where possible, and be mindful of very high calcium intake without balance, since calcium and magnesium compete for absorption. Step 1 of 5, experience, observe, track, and adjust. This is the step that turns good intentions into real, lasting results. Keep a simple daily log of your key symptoms, things like how many cramps you have at night, the quality and length of your sleep, your daytime energy levels, and any changes in mood or mental clarity. Adjust the form, dose, or timing slowly based on what you notice. Most people begin seeing positive shifts: fewer leg cramps, better sleep onset and depth, steadier energy, and less anxiety or irritability within 2 to 4 weeks. The changes start subtle, but build powerfully over time when you stay consistent and attentive. So what does the timeline actually look like when someone follows the Relax Protocol carefully? In week 1, improvements are usually gentle and understated. Perhaps a bit less twitching or restlessness in your legs at night, evenings that feel slightly calmer overall. By week 2, deeper sleep often starts to emerge. That heavy morning fog begins to thin out, and you might sense a small but real uptick in energy during the day. Weeks 3 through 4 tend to bring more obvious, measurable progress. Nighttime leg cramps can drop by 50–70%. Energy feels far more consistent from morning to evening, and if constipation was part of the picture, digestion often improves noticeably. From week 4 onward, the full transformation unfolds. Sleep becomes truly restorative. Anxiety and tension ease. Daily energy stabilizes at a higher level, and your mood feels more even and resilient. This isn't just a minor, gradual shift. It's a quiet yet profound change that builds steadily over weeks, rather than depending on quick fixes, guesswork, or trendy fads. Before we wrap up, I need to be very clear about safety and precautions, because your health always comes first. The Relax Protocol is not intended as a cure or treatment for any medical disease or condition. You should never stop or change any prescribed medications without direct guidance from your own doctor. If you have existing kidney disease, any history of serious heart rhythm problems, or you're currently taking diuretics or other medications that affect electrolyte balance, please consult your physician before beginning any form of magnesium supplementation. Always start low and go slow. Begin with 100–200 mg per day, and only increase gradually to allow your body to adjust comfortably and minimize any risk of digestive side effects like loose stools. Magnesium is generally very safe when used sensibly, but high doses taken too quickly can cause temporary stomach upset in some people, and it can interact with certain medications. Monitor how you feel carefully. Safety and gentle restoration are the top priorities. Think of this process as carefully repairing and strengthening the foundation of your home, rather than trying to slap on a dramatic new addition. Here's my personal challenge to each of you watching or reading this right now. Pick just one single piece of the Relax Protocol that feels doable for you. Maybe that's choosing and starting the right form of magnesium supplement, or committing to adding more spinach, Swiss chard, or a handful of almonds and pumpkin seeds to your daily meals, or simply beginning to track your cramps, sleep quality, and energy in a simple notebook or phone note. Whatever it is, stick with that one element consistently for the next 30 days. Then come back to this video, or post, and leave a comment sharing what, if anything, changed for you. I personally read every single comment, and your honest experience has the power to encourage and help hundreds of other people who are in the same boat finally start connecting the dots for themselves. If this information resonated with you, and you found value in understanding how something as simple as magnesium can quietly influence so many aspects of how you feel day to day, please take a moment to hit that subscribe button if you haven't already. That way you won't miss the next video in this series. Next week, I'm going to dive into several other under-the-radar nutrients that can make a real difference in protecting and supporting your bones, your brain sharpness, and your cardiovascular health once you're past 60. I can almost guarantee that at least one, if not two, of the nutrients I'll cover are ones most conventional doctors rarely bring up during routine checkups, even though the research supporting them is strong and growing. Before I sign off, let me leave you with one final thought to carry with you. Your body has been an incredible companion through every season of your life. The long work years, raising families, weathering stresses, celebrating joys, and everything in between. The muscles that carried you upstairs and across rooms, the heart that beat steadily through every challenge, the nervous system that helped you think clearly and stay calm when it mattered. All of these systems have given so much. They don't deserve to be quietly undermined by a mineral shortfall that so often gets overlooked, only to be labeled as normal aging when something far more addressable is at play. The beautiful part is that turning this around doesn't require drastic measures. No fasting regimens, no exotic superfoods you've never heard of, no spending hundreds of dollars every month on complicated protocols. It starts with awareness, then small, consistent, intelligent choices. The kind of choices embodied in the Relax Protocol we just walked through together. Building a steady routine, eating magnesium-rich foods thoughtfully, listening to your body by selecting the right supplemental form, optimizing absorption through smart timing and synergy, and paying close attention to your own experience so you can fine-tune as you go. Your muscles, your nerves, and your heart have carried you faithfully through decades of life's ups and downs. They deserve far better than to be quietly depleted by an underappreciated magnesium shortage and then dismissed as just getting older. The good news is that you can begin restoring proper function without complexity, without fear, and without unnecessary confusion. If this information resonated with you and you found it helpful, please make sure you're subscribed so you don't miss what's coming next. In the following week, I'll be sharing more about several hidden but powerful nutrients that can offer real protection for your bones, your brain, and your heart after age 60. And I can promise you that at least one of them is overlooked or under-discussed by most doctors even today. Thank you so much for staying with me all the way through. If you made it to the very end, go ahead and type Relax Magic in the comments below. I'd love to see how many of you are here and ready to take that first small step.